All right. Good afternoon and welcome to my presentation on syphilis in relation to maternal health. So, we're going to be talking about syphilis, how it is transmitted, contracted, and how it affects the fetus, why this is important, and the differences of these occurrences between developed and developing countries. So let's go over what syphilis is. Syphilis is a bacterial transmitted infection. Oftentimes it's going to cause sores or a rash, as shown in these pictures. So, like shown in these pictures, syphilis is going to occur on your genital area, your rectum, oral area, or other parts of the body. So, it's more likely to be found in the genital area because it is a sexually transmitted infection. But individuals can also have occurrences of syphilis on other parts of the bodies if that's where they came in contact with the bacteria that causes syphilis, which is Treponema pallidum. This disease is often easily treatable with a dose of penicillin or antibiotics. But the longer it goes undiagnosed or untreated, the more life-threatening it becomes to an individual or an individual who is pregnant. So there are 4 stages of syphilis as shown in this chart. The first stage is the primary stage. Individuals are going to have the primary phase occur about a month after the exposure. For example, if an individual came in contact with Treponema pallidum in March, they would not notice the primary stage until April or late March. During this stage, the individual will not have anything that is too concerning, more likely a rash or sores that are painless at the area of contraction. Your secondary stage is when most people seek treatment. Now, this stage occurs a month to 2 months after primary occurrence. So, if an individual, like we said in the previous example, contracted syphilis in March, they might notice syphilis becoming more serious and severe in symptoms in April or May. During this stage, you're going to have a rash, which we showed in the previous slide. This rash will probably start to go to other parts of the body. So let's say the rash occurred in the primary stage at the genital area. Well, in the secondary stage, the rash can start to spread to other parts of the body like the hands and the feet. Condyloma lata is also common, and this is when warts are seen on the genital area. And individuals might also experience immune responses. So you're going to have a swelling of lymph nodes, fevers, chills, the type of responses you would see if your body was trying to fight off something like the flu. The latent stage and tertiary stage are more rare. The latent stage can occur early or late. So the latent stage that's early is going to be less than a year after infection. A latent stage that is late is going to be over a year after infection. During this stage, many of the symptoms seem to disappear, and this is because the body has grown used to fighting this infection and adapted to living with the infection and functioning with the infection. This does not mean that an individual is cured of syphilis or that it is gone from the body. In the tertiary stage, this is the most life-threatening stage and occurs the latest after the primary occurrence of syphilis. So you're going to see this a year to 10 years after the infection. This is when serious symptoms occur: cardiovascular issues, coronary arthritis, and central nervous system issues, seizures, and paralysis. Now let's talk a little bit about the origin of syphilis. So there are lots of inferences and hypotheses regarding where syphilis originated from. The most popular is the hypothesis that syphilis came from pre-Columbia Central Europe in the 1400s. It is hypothesized to be carried by the Christopher Columbus's crew. So, on their way over on the ship, as shown in the lower left-hand corner, Because of the close quarters and living conditions, there wasn't plumbing, sanitary bathrooms. They were most likely defecating by using buckets, and those buckets probably weren't cleaned or disposed of every day. And because of the close proximity to other people, infections could spread very, very easily. So much of the crew became sick, too sick to storm Naples, and the ill experienced this rash that caused rotting flesh. Now, during this time, treatment was said to be worse than the disease itself. They were treated by steaming hot wood. They thought that maybe burning the ulcers and the sores would get rid of the disease altogether. Sweat baths, which were extremely hot, and mercury, which obviously resulted lots of time and death. It is also important to note that the reason why syphilis occurred, or is hypothesized to have occurred from the crew of Christopher Columbus, is because many orgies would occur after fights as a form of celebration. So we're going to talk about now how syphilis is transmitted, what risk factors increase the individual's chance of being infected. Syphilis is primarily transmitted through sexual contact, or transmitted from the uterus to the fetus, so in utero between a mother and a fetus if she is pregnant. It can also be transmitted on accident in a non-sexual way, and the way it spreads is from sores to open abrasions on the skin, or, of course, sexually. So, to give an example of this, let's say that an individual has a syphilis rash on their hands. They go to the store and they open the door. The next person after them who's coming out of the store has a paper cut on their hand, touches the door handle. They can contract syphilis because of the open abrasions on their skin and that bacteria that was transferred from the first person's hand onto the door handle or the doorknob. So some risk factors include already being infected with HIV. This weakens your immune system and the body's ability to fight off bacteria, and also shows that most often the way both of these diseases are occurred is because of sexual contact and unsafe sexual practices. The drug use of opioids, so this would occur from lots of individuals obtaining opioids in exchange for sexual favors, sexual tourism in European countries, and multiple sexual partners. Now, focusing more on the topic at hand, maternal syphilis. So women who are infected with syphilis and go untreated can greatly introduce life-threatening symptoms to their newborn. So this can occur in utero and also after the child is born. For example, if the child is fine in utero and the woman is asymptomatic and goes untreated for syphilis, the newborn baby could be fine, theoretically, but then could have life-threatening symptoms, a year after. So, they're never in the clear for it. So bacteria is able to get to the fetus by going through the placenta. And the placenta is basically where the fetus receives its nutrients, how the baby eats, basically. So here are some of the symptoms that newborns can experience after birth. So spleen and liver swelling beyond the normal size. This is life-threatening, obviously. If the spleen and liver are too big for the infant's body, this can result in death. The rash that we saw in the first slides will also occur on the newborn infant's skin. Warts on the genital area, snuffles, so cardiovascular and respiratory issues, jaundice, yellowing of the skin, restriction of motor function due to pain, anemia, an iron disorder, edema, swelling of the limbs and the hands, and malnutrition, so below average birth weight or struggling to maintain the average weight. In more severe cases, syphilis can result in stillbirth or death during pregnancy. Syphilis occurs most in Asia. Now, syphilis is treated and detected in these ways. So, syphilis is screened for by a blood test, and it is treated by a dose of penicillin. The blood test drastically increases success rates and decreases the chance of congenital syphilis. And the penicillin kills the syphilis bacteria and prevents further damage. But it does not get rid of the damage that's already done. So going back to slide 3 here, let's say that an individual has a dose of penicillin at the latent stage. It'll prevent tertiary features, but it will not get rid of the rash or the painless sores that were occurring in the primary and secondary phase. So according to the World Health Organization, 65% of women with syphilis-related pregnancy had adverse outcomes. So this would be the baby died during pregnancy before the due date in the womb, or born with life-threatening symptoms. We're going to look more specifically into geographical locations in relation to syphilis. So if the treatment for syphilis is easy, a simple dose of penicillin, why are rates still so high? In developed countries like the United States and Austria, incidence rates are high. In the United States, the incidence rate is 23.3 cases per 100,000 live births, which is a 153% increase, case fatality rate of babies born with congenital syphilis being 6.5%. In Austria, there is about 1.4 per 100,000 live births, which is an increase of 37%. In Albania, there is 3.2 per 100,000 live births. In Algeria, there is only 1,200 documented cases between 1990 and 2010. Overall, the incidence of syphilis is an estimated 12 million new cases annually. It is important to note that developing countries and developed countries have distinct differences that contribute to these case occurrences. This just shows some differences between developed and developing countries. The basic difference between developed countries and developing countries is the infrastructure politically, economically, and socially. So, a developed country will have higher contribution of industrial services, higher GDP, overall, sufficient health resources, and sufficient sources like a urban lifestyle. And a developing country, those are more likely to be your third world countries with lower GDP, lack of infrastructure, weak governments, and lack of gender equality between men and women. You're in the United States and Austria, you're seeing an urban lifestyle, adequate healthcare. They have the sufficient resources to treat patients at hospitals and access to health resources regardless of social or political determinants. While as in Algeria and Albania, you're more likely to see a rural lifestyle where healthcare is limited, resources are insufficient to provide healthcare to those in need, women are less able to access healthcare because of gender inequality or Islamic laws, and unfit living conditions due to differences in sanitation and hygienic practices. So let's dig a little bit more into what this means. In the United States and Austria, individuals can walk or drive to a hospital and easily get health care regardless of if they are a woman or a man. But in Algeria and Albania, individuals are unable to seek health care, especially if they are a woman, due to Islamic laws. So according to Islamic laws, women aren't even seen as a person. They are property to men, and they must follow what a man says. They are not even considered a whole person in court. Because of this, it's going to be a little bit harder for them to access health care. Men are going to be less likely to allow them to go to the hospitals out of fear that they will be disobedient toward them or come in contact with other men who are most likely going to be the doctors, because women cannot get the education they need to become a doctor. So some inferences and determinants that I drew based on my research between developed and developing countries. Well, I concluded and hypothesized that developed countries like the United States and Austria have had changes in sexual practices, which increases the rates of syphilis. as time evolves, children, or adolescents, I should say, and teenagers are more likely to be sexually active at a young age, and schools are not teaching as much on the practices of safe sex, and parents are less likely to be talking to their kids about safe sex. Because kids and teenagers and young adults are participating more in casual sex or hookups or unsafe sexual practices, these syphilis rates are going to increase because of the increase in sexual partners, especially with the decreasing average age to be sexually active. There is minimal education provided about syphilis, so despite the education system in these developed countries and, everyone, regardless of gender or sexuality, being able to receive an equal and high prioritized education, people or professors and educators are not informing individuals about the dangers of syphilis, the risk of syphilis, and how common it is, and how common sexually transmitted infections and diseases are in general. And there is a stigma around being open with doctors, so there is some embarrassment with telling your doctor that you have multiple sexual partners, or that maybe the sexual practices that an individual participates in might be a little bit different. For instance, oral sex or oral sex with multiple partners. This can be seen as taboo to talk about with your doctor. In developing countries, there is a lack of medical centers and supply. For instance, in my paper that I wrote, there was only, I want to say, around 330 doctors per 30-something thousand patients, so it's very low. There's strict Islamic laws against women, like we talked about in the previous slide, and there's health issues that are more frequent due to cultural practices or living conditions. So in Albania and Algeria, there's going to be cardiovascular diseases and respiratory illnesses. Due to the desert area, there is going to be lead poisoning due to inadequate water supply. And these diseases just take prevalence over syphilis because it is more of an occurrence and more common, and there is not because of the strict Islamic laws, their individuals are less likely to have multiple sexual partners. In conclusion, syphilis is an issue worldwide. Many individuals are unaware of their infection and they fail to treat it, which results in syphilitic stillbirth and also life-threatening symptoms to the individual who contracts it. So the stillbirth and congenital syphilis occur in developing countries where healthcare and health resources are scarce, but they also occur in developed countries because of a lack of education and stigma around being open with your doctor. My call to action would be to provide education to the public about sexually transmitted infections and diseases. This includes information about safe sex, like we said, the STDs and STIs, what to do if an individual has symptoms of an infectious disease, and how the diseases are treated and what to do to prevent them. So the use of condoms, male and female, also refraining from having casual sex, and if you do have casual sex, use protection every time. Enforcing the idea that birth control is not a form of protecting an individual against, STDs or STIs. That's only a form of preventing a pregnancy. Now, this might be difficult to do in developing countries where there are a lack of technological advances, but strides must be taken to ensure that all women have access to proper maternal health care. Now, this could be a long process because there must be changes in Islamic laws, especially in these developing countries. So the strides to be taken would be to propose, so laws or regulations that require all women to be treated during these, or maybe setting up healthcare systems in these countries that can treat women, or a nonprofit organization that could meet a timely manner in which they screen women for these STIs and STDs. And these are my references that I've used.